Alright, so you get to follow along as I go to my annual PT appointment. I have headed into my nearest city and I've worn athletic clothes because it's often very active in terms of you want to check out your movement and different things like that. So I will go ahead and hop inside and see how it goes.
I've been seeing a pelvic floor physical therapist since just after my first baby was born. Honestly, I was lucky. I had already connected with a local PT through my doula community before I even knew I had any pelvic floor symptoms. They hosted monthly talks and brought in local resources, and pelvic floor PT was one of them. I had actually purchased a postpartum package before I had any symptoms at all. And then when the heaviness and pressure started, I already had someone I trusted to call, and that made everything feel so much less scary. Now I see my pelvic floor PT annually. It's become part of how I take care of my body, similar to how I see my OBGYN every year, because my body changes over time, and pelvic floor PT focuses on things that my OB doesn't usually have the time, training, or appointment structure to fully assess. They are really different areas of expertise. And that's not a criticism, it's just a difference in their scope. Your OBGYN is typically focused on reproductive health, screenings, pregnancy, and diagnosing conditions. A pelvic floor PT is focused on how your muscles, your breath, your core, your posture, your movement, and your patterns and your symptoms are all working together in real life. And they're very different kinds of care, focusing on different parts of the body. Pelvic floor PT can help with a wide range of symptoms: pelvic heaviness and pressure, pelvic organ prolapse, pregnancy and postpartum recovery, pain with sex, constipation, low back and hip pain, and difficulty coordinating pelvic floor muscles, whether they're too tight or too lax. The one thing that I want to be sure to say is that pelvic floor PT is not just Kegels. I get asked that a lot. So when women need strengthening, some may need that. Some need to learn how to release and relax their pelvic floor. Many need both, plus work on breathing, posture, how they move through your daily life. A good PT assesses you specifically and builds a plan around your body and what it actually needs. So if you've been putting off going because you thought it would just be someone telling you to do more Kegels, please let me reassure you that that is not what good pelvic floor PT looks like. And every clinic is different, and mine doesn't feel cold or sterile or overly medical. It's welcoming, it feels calm. When you're already dealing with vulnerable symptoms, that environment matters a lot. A space that feels safe can help your nervous system actually settle down before the work even begins. For me, after checking in, I meet with my PT in the treatment room, and we usually start by sitting in chairs and just talking, not on an exam table, not immediately undressing, just talking. She asks about my symptoms, what's changed since my last visit, how my bathroom habits have been, what activities feel good, what makes things feel worse. And for a first appointment, you usually fill out a detailed intake form ahead of time so that your PT has a lot of context about you and what you're experiencing before you even begin that first conversation. And this is where I found that symptom tracker to be so helpful. As a busy mom, just a busy woman in general, it can be hard to actually remember what's been going on in my body. If someone asks how often I'm feeling heaviness or what my pressure is like on a scale of 1 to 10, I don't want to answer based on only what happened yesterday or this morning. That's recency bias. Tracking for even a week or two before your appointment can give you and your PT a much clearer picture of what's going on in your body and how that changes from day to day. Now, the part that a lot of women tend to feel nervous about is the pelvic floor PT appointment, including the internal vaginal exam. But it should always be explained, it should always be consent-based, and always optional. And a good provider will communicate this clearly, they will move slowly, and they will make sure you feel comfortable throughout. Please don't let the internal exam be a reason that makes you pause or hesitate going to see a pelvic floor PT. Let them know up front, and a good one is always willing to work on this with you, and they're not required either. In my experience, after we talk through symptoms, my PT explains what she recommends and asks if I'm comfortable with the exam. If yes, she leaves the room, I take off my bottoms, cover myself up with a drape, and then sit on the exam table in that same room. And then when I'm ready, she comes back in. The internal exam uses a gloved hand and she gently inserts her finger into the vaginal canal. I know that can sound intimidating when you say it out loud, but in my experience, it's usually quick, it is absolutely respectful, and for me, it's not painful. I know for others that that can be a point of concern. Again, if it is, tell your provider. They have so many ways that they can work with you to help mitigate anything that you're feeling and make sure you are as comfortable as possible. And then what she's assessing is things that you can't understand from the outside. She'll assess how your muscles engage, how well they relax, whether there are areas of tenderness, how coordinated your muscles are, whether you might be bearing down instead of lifting up. For prolapse symptoms, the assessments sometimes happen while standing. And this is because prolapse can behave very differently when gravity is involved. The first time you do it, you're like, okay, what is it that you want me to do? And essentially what it is the provider will have you with their fingers inserted, gently shimmy off the table and stand with your drape around you so that they can feel how that changes. And this is critical because a lot of times women will be told that they don't have prolapse in other settings because they're examined laying down. And things just change when you stand up. So with the right provider, this does not feel embarrassing or dramatic. It feels like somebody who is skilled is gathering information to help you. And if you ever don't feel safe, respected, or fully informed, just find someone else. There are a lot of options out there, and finding the right PT can just truly be a game changer for you over the course of your life. You deserve to feel heard during this kind of care. And I know I don't want people to think I'm flippant when I say just find someone else. I know that this can be incredibly hard. Getting out of a healthcare situation for so many reasons, whether it's access, financial, there's all kinds of reasons. So I don't take that lightly. But if you do have a bad experience, do what you can to find somebody else because with the right provider, it does make all the difference. So then after the internal exam, she leaves the room so I can get dressed. Then we walk through and talk through what she noticed. And she does a lot of the talking too while we're going, because one of my biggest things is the cues between bearing down and being able to effectively lift up. So that's something we work on a lot. But then after the exam part, most of my appointments include some manual work. So she'll do release work around my abdomen, my hips, or my lower core. And this can just feel like her like working her way across my abdominal muscles to help release that tension. And it really is incredible what kind of impact that can make for your symptoms in the moment, because tension in other parts of your body can directly affect how that pelvic floor is functioning and feeling. And then we'll move into a movement assessment. So she might watch how I breathe, how I squat, how I hinge, how I lift. She will do things like essentially having me like lift my leg, and then I have to push down against her. And essentially she's gauging my strength and watching how my muscles engage when I do different activities like that. And I'm saying all this because it shows you that it's this multifaceted approach. And that's because your pelvic floor symptoms don't usually happen when you're on that exam table. They happen when you're loading the dishwasher, carrying a suitcase, picking up those little kids, or walking the dog, which is something that you like to do on a daily basis. A good PT can often spot things that you never think to look for. Things like holding your breath when you're doing a movement, bearing down, clenching your glutes or your jaw, overusing your lower back and accommodating in different ways, avoiding certain muscles without realizing it. And that's where pelvic floor PT becomes genuinely practical and it meets you in your real life.
And so that also makes me think, I know sometimes people who are struggling with something, they may feel hesitant to reach out for various reasons, right? What would you, if you were talking with them, what kind of guidance would you give somebody who's hesitant to reach out and seek help?
So definitely, I would say just I get it. It's scary. Just do it. If you are hesitant, you have concerns, especially about an internal exam or something, let your pelvic floor PT know because they will walk you through it. And you definitely don't have to have an internal exam, especially not on the first couple visits. It does give vital information, but we're not going to do anything that you are not comfortable with because our goal is to make you feel comfortable.
I wanted to let you hear it from a provider directly because I think it lands differently when it comes from someone who sees patients every day. One thing that can make your first appointment so much more useful is going in with some information about your own patterns. Our free pelvic health symptom tracker is a simple PDF that you can use for just a week before your appointment to note when your symptoms are better and when they're worse. capture the activities that seem to be connected, and then the questions that you want to ask. I'm going to link it in the description below. It's free, and your PT can genuinely appreciate you having taken the time to reflect on what you were feeling coming into that appointment. One of the things that I appreciate the most about my PT is that we talk through the plan together, because the best plan is not the most complicated one. It is the one that you'll actually do. If your PT gives you a 45-minute routine and you have a newborn, a toddler, a job, and about 7 minutes of alone time per day, that plan's not going to happen. A provider will work with your real life. The homework that I've been given over the years has ranged from breathing exercises to gentle mobility work to strength exercises to posture adjustments. Sometimes it's as simple as changing a bathroom habit or modifying how I lift. Small things that make a real difference when you actually do them consistently. And here is something I want to call out directly because it really matters. That is that pelvic floor PT is a long game. It builds strength and coordination and awareness over time. And that work is worth doing. But while you're doing it, you still have to live your life. You still have long days and workouts and travel and school pickups and just all of it. And that's where a support garment fits in for me. Him is not a replacement for the work that I do with my PT. It's what I wear on the days when I want to feel more comfortable when I'm doing that work, like wearing a good ankle brace while you're rehabbing a sprain. The brace doesn't fix the underlying issue, but it gives you the stability so that you can actually move throughout your day while you heal. Chelsea Tetro is a DPT in Rhode Island who recommends him to her patients, and she put it well. She says many patients fear a pessary or surgery are the only options, and having a supportive garment as a conservative option gives real relief in the short term while they work on their longer term goals in therapy. That's exactly how I think about it too. So if you've been nervous about making that first pelvic floor PT appointment, I hope that this has helped. It's not as intimidating as it might sound, and it is worth going. The right provider will make you feel heard, informed, and like you have an actual plan, not just a diagnosis and then hand you a pamphlet. I'll link the symptom tracker in the description down below so that you can start tracking before you go. And I'll link the full blog post this video is based on if you want to read through everything in more detail and hear about my personal experience going through my pelvic floor PT appointment. Take good care of yourself, and I'll see you in the next video.